Welcome to the deep dive. It feels like there's just this constant flood of new information, especially in areas like health and medicine.
Absolutely. Keeping up is, it's a real challenge.
Yeah, it really is. And that's exactly why we do this. We don't just skim the headlines. We try to go deeper, pull out what's genuinely important, and, make it actionable for you. So today, that's the mission. We're diving into the latest, most impactful updates in cardiovascular care. Think of it like your shortcut to understanding the key changes happening right now in heart health. We're looking at guidelines, trials, new therapies, the works.
Exactly. And our aim is to really connect the dots across 6 main areas. We'll start with managing common things like high blood pressure, but we'll also get into some really cutting-edge treatments and even emerging risk factors. The key isn't just what's new, but why it actually matters for, patient care and just your general understanding.
And there's some genuinely surprising things in here. We're talking tighter blood pressure targets, a maybe unexpected shift in therapy after heart stents, those GLP-1 drugs making waves beyond diabetes, changes in heart failure care standards, new options for a rarer heart condition, and this thing called lipoprotein A, which you'll definitely want to know about. Okay, ready to jump in. Let's start with something pretty foundational. Blood pressure.
Let's do it.
So the 2024 European Society of Hypertension guidelines just dropped, and they seem to signal a real move towards, well, more aggressive management.
Yeah, that's a fair assessment.
And here's where it gets really interesting. The new target. They're talking systolic blood pressure, the top number, aiming for 120 to 129 millimeters of mercury when tolerable. That feels like a pretty big push, doesn't it?
It absolutely is. From a preventive cardiology standpoint, it's a strong message. The biggest mindset shift, I think, is moving from just reacting in the clinic to being much more proactive.
Okay, proactive how?
Well, mainly through home blood pressure monitoring. Really leaning on that, using validated devices, of course.
Okay.
It just gives us and you a much better sense of your true day-to-day blood pressure.
Right, not just that snapshot in the doctor's office.
Exactly. But, and this is crucial, we need flexibility, especially for older patients or maybe those who are a bit more frail. Pushing too hard could lead to orthostatic hypotension.
That's the dizziness when standing up.
Precisely.
Yeah.
A sudden drop in pressure that can lead to falls. So for elderly patients, you absolutely have to check orthostatics, measure BP, sitting and standing, and be cautious. Management-wise, the guidelines push for using combination therapies earlier. Maybe an ACE inhibitor plus a thiazide.
If you are looking for outsourcing services, head to Adept today by visiting www.staffingly.com or emailing us at